Hi, everyone. I am Dr. Jenn or Dr. Baker from www.drjenmed.com, the premier in-home medical care service. Today, I want to drop an important gem. I want to talk about the care of the stroke patient when they're back home. So you've survived the hospitalization and you are back at home. And I'm just going to leave a very important tip. So if you or your loved one or a relative or someone you know has had a stroke, please share this video with them. It might be a matter of life and death, right? Now, today I'd like to talk about blood pressure. We all hear about blood pressure, whether it's high or low or whatever, right? And we know how it can, how it can cause so many problems. Now, when you're back home and you're trying to get back on your feet, quite literally, right? You have to monitor your blood pressure. I really remember near where I live, there was this gentleman. He had had a stroke. The hospital did good. He came out, he was okay on his medicines, all of that, right? And his blood pressure went too low and he had another stroke. He had another stroke. He had to go back to the hospital again. And of course, things were worse this time. Thankfully, he's still alive and he made it and all of that. But what I'm saying is that you have to monitor these things. You might think it's a little, you might not even be thinking about it. Like you think, okay, I'm taking my medicine, so I'm okay. You have to know the blood pressure numbers. My best advice to people is to get a blood pressure machine. Just trust me, buy one. Go to the pharmacy or ask a relative from abroad to send you a blood pressure machine. You just put it on your arm, the thing pumps up, and you get a reading. And the reading will have two numbers. It will have a top and it will have a bottom number. Now, most people, we aim for like 130 over 80. Those are the two numbers, right? So if it's going too high, crazy high, or if it's going too low, you can have another stroke. So let's say you came home and you could walk. Now you have another stroke. You can't walk sometimes. Maybe you could have swallowed and you could talk. A second stroke is like another insult. You know what I'm saying? So you really don't want the blood pressure to go too high or too low if you could really avoid it. You know what I mean? Something as simple as monitoring the blood pressure, right? So these are the important little gems that people may not know when they're at home caring for a loved one who's been sick. And which is why I'm so passionate about doing this, because it really affects people's quality of life. The person could walk, now him can't walk. You know what I mean? Now, for more information or more tips, I'll try to do a video each week, right? I'll try because these things are so important. In the meantime, you can contact me here on the Facebook. You can contact me on my website, drjenmed.com, because we provide doctors and nurses to go in home, right? To train you, to teach you, to tell you everything. In fact, we have a premium package. If you just came out of hospital, we can hold your hand for the whole week and tell you what to do. You know what I mean? So these are the little things that affect people's quality of life, And I hope you found this helpful. It's my first video. Be nice. If you have any comments you may share, I'm happy to help if I can. Have a good day. Take care. Bye.